Now to stories outside of Nigeria, authorities have launched a cholera vaccination drive to contain the spread of the disease as neighboring Mozambique records a surge in infections and deaths. Mozambique's Tete Province has become the epicenter of the outbreak, with health officials reporting dozens of new cases in a single day and at least 12 deaths. The surge follows weeks of severe flooding that has displaced millions and heightened public health risks. Meanwhile, health authorities say suspected cholera cases have been recorded locally, with measures in place to prevent community transmission and limit cross-border spread. And now to discuss this further, we're joined by Executive Director of the Malawi Health Equity Network, Jobe from Lilongwe. Thank you so much, Mr. George, for joining us. With the outbreak worsening in Mozambique's Tete Province, what concrete steps are being taken to prevent the cross-border transmission?
There's a lot that Malawi is doing. For example, at the moment, there's a lot of awareness raising to the people, like sensitizing them to know we have this situation at the moment, and also every day there's the updating of cases that have occurred. And at the same time, we have also seen that there's increased distribution of chlorine to houses, especially those whose communities do not have reliable sources of clean water. And also there's contact tracing, like when one has been found with the cholera. There are efforts to trace who has been in contact with such a person, so that at the end of the day, treatment is given to the people. So these are some of the activities which are happening, and because we already know about issues of our neighboring countries, that they may also have the cholera cases. So there are some talks between Malawi and the other countries, but at the moment we can say we have continued to register cholera cases, which requires everyone to take responsibility. Here we are talking about the Ministry of Health. We have councils, district councils, development partners like NGOs, but the citizens themselves. As Malawi Health Equity Network, we have been also telling the citizens that even if everyone did whatever they do, but the actual citizen, if they do not follow preventive measures, we cannot completely deal with the situation.
So what is the current cholera situation locally? How does it compare with the previous outbreaks that the country has had?
We have not reached the critical situations because the first case of cholera was officially reported on the 11th December 2025. Since then, we have had 2 people who have lost their lives. May their souls rest in peace. And we now have registered almost 66 cases. Of course, out of such numbers, others are discharged out of hospitals. At the moment, we have about 10 people who are admitted. When we compare with the previous years, especially when cholera came to the highest levels, from December to now, we could have lost many lives. We are not belittling the 2 lives that have been lost, because every life is 100% to the family members. But at least the situation has not worsened. And this is why, as civil society organizations, we are even calling development partners that it is the right time to come and invest a lot of resources before the situation may worsen.
All right. Thank you so much, Executive Director of the Malawi Health Equity Network, Mr. George Jobe, joining from Lilongwe. We appreciate your time with us on the news.